The CDC expects the flu and coronavirus to both spread this fall and winter. Dr. Richard Chaffoo joins us to help you tell the difference between the two. Well, first of all, good morning to you, Doc.
Good morning, Kristina. Good to see you.
Good to see you. Now, there are a lot of, I hear people talking about this all the time, a lot of different misconceptions about the two. So can we talk about some of this? Like, for one, I'm hearing people who say, you know, the flu won't be a problem because we're already wearing masks and social distancing. For instance, like, how accurate of a statement is that?
It's not entirely accurate, Kristina. You know, as we know, both of these are viral illnesses, and they're both spread most often by respiratory means, which means that if you're wearing a mask, if you're doing social distancing, if you're being careful, avoiding any large crowds or enclosed spaces with a lot of people, that you are less likely to get the flu. And experts are hopeful, Kristina, that this year our flu season will be less severe. In other words, we'll see fewer people that get the flu and perhaps fewer hospitalizations, and we hope fewer deaths. But remember that it's also, viruses are also spread by contact. So contact surfaces are another factor that we can see can be another cause for spreading these viruses. So while the masks are helpful, that's only one factor.
Well, I mean, it's definitely a good thing, though, then that people are washing their hands a lot longer. Actually, I take that back. People are finally washing their hands as they should.
Right, exactly.
And so hopefully that helps a lot. Well, what about, you know, they talk about the flu vaccine, and we've been hearing stories about, you know, from doctors who are saying, get the flu vaccine now because of the pandemic. Well, can the flu vaccine make you more vulnerable to COVID-19?
Actually, no. You know, you're not going to get ill from actually getting the flu vaccine. First of all, it's a dead virus. It's not a living virus. And if you get symptoms from getting the flu shot, Kristina, it's just symptoms related to your body's immune response. It actually means that it's working. So when I get the flu shot every year, you know, I might get a little bit soreness in my arm, a little muscle ache, this sort of thing. Some patients will notice a slight fever, but that's about it. It's very short term. And the important things, Kristina, are that that, you know, you can still get the flu. Unfortunately, if you get, let's say you get a vaccination against the flu virus, if you contact the flu within that 2-week period before your immune system had gotten to a certain level, you could still get the flu. Also, as we know from last year, you know, when it was a particularly significant flu season, there was more than one strain, and it might be that you could get the flu shot and unfortunately catch the strain that the vaccination has not been specifically developed for. But one of the most important things is the take-home message for the public is that getting the flu shot will reduce your risk of getting both of these illnesses together, which, as we could imagine, could be much more serious and more catastrophic. If you have the flu and you're ill from the flu and now you get COVID-19 on top of that, of course, being a respiratory illness, your likelihood to have a serious illness or hospitalizations or something worse are significantly higher. So if you've always sort of put off getting your flu shot every year, this is not the year to do that.
Okay, so real quick, so COVID-19 and the flu, they have similar symptoms. So how do we tell the difference?
So that's a great question. Early on, you probably cannot, because remember, as respiratory illnesses, the early symptoms that you will see will be a fever, cough, fatigue, and so those early symptoms are very similar in both. The difference is that it can be the severity of the symptoms, you know, and more likely you're to have more severe symptoms for a longer period of time with COVID-19 than you are with the flu virus. But as you said correctly, early on the symptoms are very similar. But remember, the death rate is different, obviously. You know, we saw in the last flu season, the 2018-19, we saw about 34,000 deaths from the flu. We've already seen over 200,000 deaths from COVID-19. Also, the contagious period. We know, for example, with the flu, people say that experts will tell us that once you've stopped having a fever, you can go out and about within about 24 hours. Not the same with COVID-19. You need at least 10 days of being symptom-free before you're safe to go out and not infect someone else.
And so I'm going to assume if you start to feel these symptoms, obviously you're going to want to stay home just in case, because you don't know which one it is, and then contact your doctor.
Yes, you want to hydrate yourself. You want to rest. Again, you want to stay away from other people. Still wear your mask, you know, during that period where you're contagious. Make sure all contact surfaces are cleaned off, especially if they're common surfaces in your home that you share with other family members.
All right. Dr. Richard Chaffoo, thank you so much for joining us this morning. Good information.
Thanks, Kristina.
Thanks.